Good afternoon. Okay, we're going to get started. Hey everyone. Welcome to our presentation this afternoon. My name is Amy Harvick and I'm the Educational Chairperson of FLCA. After the presentation, please, for those of you that are attending in person, fill out your evaluation form and bring it to me at the end of Anita's presentation, and I'll provide you with your CERB certificate of attendance. If you're listening via webinar, make sure that we have your appropriate email address, and please fill out your evaluation, which should be linked to you via the webinar as soon as possible, and I will have your CERB certificate to you via email within 1 to 2 weeks. I try to get them out as soon as possible. This afternoon we have a wonderful speaker for you. It is Miss Anita Hawn, who is now known as Anita Conley. So any further correspondence will have her updated name. She's also in the Orlando Health System now as Anita Conley. Anita is a board-certified specialist in pediatric nutrition. She works at the Arnold Palmer Hospital for Children in the Feeding Difficulties Center and the Arnold Palmer Hospital for Children Pediatric Special Care Unit. And she ensures that nutritional needs are met for the children with a wide variety of diagnoses and specialized dietary needs. She's going to be speaking to us this afternoon on breastfeeding mothers and their babies and food sensitivities and allergies. And we're very happy to have her here. So I present Anita.
Thank you. So part of what I do has a lot to do with food allergies, which is part of the reason why I was asked to speak today. So just going through, we're going to talk about the management of allergies in our breastfeeding patients and mothers. So first, what we're going to talk about is defining what a food allergy is. What sorts of reactions we're looking at, and and how frequent is this? What sort of incidents do we see? Then we're going to look specifically at allergy symptoms that you might find in your breastfed infants, so that when you are assisting mothers with breastfeeding, that you can help them troubleshoot a little bit about what might be going on. We'll also discuss when you might want to refer them to see a gastroenterologist for better management of their symptoms. We will define changes to maternal diet to facilitate continued breastfeeding in the presence of allergy. We're going to learn to accurately read food labels for elimination diets, and then lastly we'll talk briefly about some of our alternative formula options that we might need for supplementation when the food allergies get extreme especially. So first, to start with adverse food reactions. We have several different types of adverse food reactions. There is hypersensitivity or allergy, which is pretty equivalent to the same thing. That's when we're having an immune-mediated response to our food, meaning our immune system is fighting off the protein. So it can be either IgE-mediated, which in the skin that shows up as itchy mouth, swelling of the lips, palate, tongue, or throat. In the GI system, it can show up as nausea, cramping, gas, distension, vomiting, abdominal pain, and diarrhea. In the respiratory tract, it can show up as coughing, wheezing, profuse nasal rhinorrhea, sneezing, laryngeal edema, and then also our very classic anaphylactic reactions, which is what most of us think about when we think about food allergies, the scary, life-threatening reactions. Then there are non-IgE mediated food reactions, and these are actually the ones that we'll spend a little bit more time talking with because they're typically the ones that we do see in breastfeeding infants. So there's a few different types, and I have more detail in later slides. There's the food protein induced enterocolitis syndrome, which we call FPIES for short. There's a food protein induced enteropathy, allergic proctocolitis or allergic proctitis, allergic eosinophilic diseases, and then celiac disease are all non IgE-mediated hypersensitivities. Then we have intolerance, which we're not really going to talk much about other than just mentioning, and that's when there's toxic contaminants in our food, or there's pharmacological properties to the components of our food, or we have a metabolic disorder, idiosyncratic responses that can contribute to reactions to food. And some examples of this would be lactose intolerance, where it's really not, it's not a true allergy. It does cause symptoms, but it actually doesn't do any damage to the body to be exposed to lactose. When you have a lactose intolerance, it just causes the uncomfortable gas and bloating. And another example of that would be if somebody gets a migraine triggered by something like MSG or aspartame. So those are intolerances and not allergies. So to talk a little bit more about our IgE-mediated hypersensitivities or allergies, first we'll talk a little bit more about the food protein-induced enterocolitis syndrome. This is not a super common syndrome, although it is being diagnosed more. It's a newer diagnosis, I would say, within the last 10 or 15 years. And so it is being diagnosed more. And so basically what's happening is there's local inflammation in the GI tract that causes increased intestinal permeability and fluid shifts. So what that looks like is that a child might drink a cow's milk protein formula. Maybe their first cereal presentation was rice, which is common in a breastfed infant, for that to be their first reaction. And then within a couple hours of having that exposure, they start to have extreme vomiting, extreme diarrhea, and dehydration that can lead to lethargy and apparent shock. So these are kids that look very, very sick very, very fast. So cow's milk protein formula is one of the big things. So usually in infants who are only formula fed, you see these FPIES reactions sooner. Typically you don't see it in a breastfeeding infant until you start introducing other things like that first rice cereal, and sometimes you get the reaction from that. It also, soy can cause a reaction, oats, barley, poultry, peas, green beans, sweet potatoes, squash, things that you don't think of as your typical food allergies for the most part. I think the cow's milk protein and soy are about the only kind of typical allergens on that list. Then next we have food protein-induced enteropathy. And so this is something that you're going to see anywhere between 1 and 9 months of age. And this is going to be that the child starts having some vomiting, they stop eating, they have extreme diarrhea, and then that leads to failure to thrive. So they stop growing as well, they might stop eating. Typically those reactions are to cow's milk, to soy, to egg, to rice, chicken, and fish. So then allergic proctitis or allergic proctocolitis is where we get rectal bleeding with no delay in growth and no core weight gain. So this is probably the most common one that we see. You know, it might present as the breastfeeding baby that's a little bit colicky and just doesn't always eat great, and then they have some streaks of blood in their stool, or you know, they're just fussy and they test the stool for occult blood and they find that it's positive that there's some blood in the stool. And so the most common culprits for that is cow's milk and soy protein. Then we have our allergic eosinophilic diseases, which are actually not super common in infancy, but basically it's where the eosinophils are recruited to either the gastrointestinal tissues or the esophagus. There's a couple different types, and so these can be caused, again, by food proteins. They can also be caused by environmental proteins as well. But one of the first lines for treatment for the eosinophilic disorders is to do a strict elimination diet and see if that improves the symptoms. So things that you see for symptoms are pain, nausea, poor appetite, vomiting, and diarrhea. Sometimes in the feeding center we've seen this as the kids who just don't want to eat and we can't figure out why. And eosinophilic esophagitis is not, it's a condition we need to make sure that we're treating, because if it goes untreated it can cause strictures of the esophagus and dysmotility over the long term. But that's typically not infants, that's more older children and even into adults. Celiac disease is also not common in infancy. It's about 1% of the total population has intolerance to gliadin, which is the protein that is found in wheat, spelt camelt, and rye and barley, and commonly we call it gluten. So again, it usually doesn't present in infancy, but it's one of the types of IgE, non-IgE mediated hypersensitivities. So then when we start talking about how common are allergies, I know in the hospital setting I get a little bit jaded. I feel like everybody has a food allergy, and I think that's partially because that's the population I see. And so when I look at the numbers, I'm like, oh, that's actually really small. Only 2 to 3% of infants or children develop cow's milk protein allergy, and of that 2 to 3%, only 0.5 to 1% are exclusively breastfed infants that develop cow milk allergy. Now, of those infants that have cow milk allergy, 30 to 40% of them will also react to soy. So that's just a very important thing to know. And then it's also important when we start thinking about these babies who are giving us more problems, and maybe they aren't doing as well on just a milk elimination, is that sometimes we have to go further and eliminate more foods. So after milk and soy, egg is the third most common allergen in infancy. So just in general, outside of infants, 1 to 8% of children have food allergies. And the good news about all those infants that do have the cow's milk protein allergy is that less than 1% of them will continue to react to cow's milk at 6 years of age. So that means that they tend to be a short-lived allergy. It's not uncommon for them to grow out of it.
Do you know?
Yes, ma'am.
Do you know if there's any correlation to the earlier you discover this sensitivity, this quote-unquote allergy, and you eliminate it, let the gut heal, do you think that that helps in not continuing to have the allergy? I just am going on it based on clinical. The moms that catch it early, eliminate it from their diet, they do great. The baby's able to have it at a year old. The ones that are in denial, they just continue. They have all these awful stools and issues and gas. And now we're at a year and we have an anaphylactic reaction, you know, or
Yeah.
still not able to tolerate it.
Yeah, that's actually a really great question. So the question was, basically in summary, do the families who kind of embrace the allergy and the avoidance of that, do they see quicker resolution of the allergy because they did that, or is it not related? And I really don't know the answer to that. What I can say about that is that in my practice, what I have seen is that children who are not avoiding their allergens well do not grow well. And that is something that I have seen over and over and over and over again. Enough to say, even though I haven't gone through my, like actual numbers of research, to say it's a very obvious trend to me that children who are exposed to allergens do not grow as well. And when we tighten up their diet and when we do a better job with that elimination, then they grow better. And just from a logic standpoint, I could see feasibly growing better, developing better, being something that helps them get over an allergy potentially quicker. I don't know that it happens for every child, but that's been my experience. But I don't know if there's any actual research to show that. So the next part of the incidence of allergies is when we talk about allergies, there are 8 different major foods that are responsible for 90% of the food allergy reactions. And those foods are milk, egg, wheat, soy, fish, shellfish, peanuts, and tree nuts. And that's kind of important to know as we are going to move, once we move on and start talking a little bit more about food labels, because there's laws that have to do with the top 8 major food allergens. It is also important to know that there have been documented reactions to more than 170 different foods. So when I look at this list as a dietitian, I say, oh, they're missing corn, they're missing sesame, they're missing cinnamon, they're missing some major things that cause reactions, and it can therefore be very difficult for those particular families to avoid the foods they need to. So when we talk about breastfed infants, there's quite a range of different symptoms that can be associated with allergies. The first one is just colic and excess crying, kind of like in that allergic proctitis situation where we talked about that really it might be fussiness is the only clue that something is wrong. And so they might just be really colicky. Sometimes you do actually see the blood in the stool. Sometimes some patients are very severe and you see copious amounts of blood in their stool. Sometimes there's going to be some dysphagia that is associated with the allergy, or frequent regurgitation, vomiting. So sometimes it can be a little bit difficult to say, is this reflux or is this an allergy reaction? And there, in more cases, can be anorexia, meaning refusal to feed, so that baby that just does not want to go to the breast, and it's really, really hard to get them there. You can see diarrhea in some cases. You can see the opposite and see constipation. I've seen food allergy kids that react to their allergen with diarrhea. I've seen other ones that react with constipation. It's quite amazing to see the difference. There can be some perianal rash that might be a clue in some of the children that there may be some allergy stuff going on because of the inflammation that is down in the colon. Failure to thrive is definitely, can be a clue. So not every child is going to have failure to thrive. Maybe some children are just not growing quite to their potential, but they might still look okay on the growth chart. But sometimes you will see extreme failure to thrive, and part of that cause could be food allergies. Iron deficiency anemia. If you have somebody whose GI system is inflamed and not working right, they're not going to be absorbing the iron from the breast milk or from the formula. So that could be a symptom of allergy. Runny nose and wheezing, you know, some of those asthma type symptoms, eczema, they kind of all go together. So if you have a baby that's fussy and has eczema, that's when you might need to think about, like, oh, do they have allergies? Chronic cough when there's no infection going on. You know, if they're coughing all the time and we've been checked out and we don't have anything going on, then we might need to be cued into that. Hives is kind of one of our standard, you know, that we think of allergy reactions. The angioedema, and then of course that real classic anaphylaxis. From what I have seen personally in the 5+ years that I've been at Arnold Palmer, I don't think I've ever seen an infant react with anaphylaxis.
I know.
So we do have somebody in the audience that has.
It actually happened at their daycare when they got a little puffs and it had a whey protein in it, and they got rushed to the ER.
Oh yeah, puffs from whey protein from puffs. It is sneaky, and that's why we're going to talk more about food labels. So when do we need to refer these babies to a gastroenterologist? Most of the time, because a lot of their allergy is a GI type of allergy versus more of an allergy that the allergist is going to see them for. Most of the time you're probably going to want to send these babies to a GI physician because they may not be growing as well, or they may need to know their other options, or, you know, make sure that their testing and workup has been done thoroughly. So some very obvious reasons. If you're having vomiting and diarrhea in the context of failure to thrive, you definitely want those babies to be seeing a gastroenterologist. Bloody stools is another reason. Now, some pediatricians feel comfortable handling that, and if they're actually addressing it and doing the tests and stuff and making the appropriate changes, that might be okay. But if it continues, it's definitely something that the GI doctors should be helping with. Yes, ma'am.
I've worked for a pediatrician for as his IBCLC for 20 years, and with the bloody stools, if the hemoglobin's good, the baby is not complaining, and it's growing well. Of course, this isn't copious amounts. It's usually just, I mean, mommy may see several stools with nothing, and then all of a sudden she sees a little streak. We just watch. Come back in for weight checks. Come back in for to check the hemoglobin. Baby's happy. Baby's not saying anything. Baby's growing, and it's usually transient. Now we do give them an elimination diet for the mom to follow too, and some of them find that that in a few weeks everything's great, and some of them still see it. We just follow them. We don't refer to the GI until unless we have the ones that are failure to thrive or are not doing well. But you're right. It depends on the pediatrician's comfort zone.
Yes. Yes. I work with the resident pediatricians, so they're still training,
Yes.
they're still learning how to be
Yes.
pediatricians, and so some of them are maybe not quite as confident as some of our area pediatricians, and it sounds like, that is appropriate management, especially if they're not fussy and, it's just occasional blood. If they're fussy on top of it and what we're doing is not working, then I would
Yes.
definitely consider in that context to send them. But if they're happy and growing, then why?
And we've seen a lot of them that are just happy campers, growing great.
Yeah, there are some children in this world, and it's easy to forget working in the Feeding Difficulty Center, but there are some that will eat regardless of if it hurts or not.
But they usually still are grumpy if it hurts.
Yeah, that is true. That is.
Yeah.
I think they eat what they want, and they're not forced to eat a full bottle like many people want to do.
Yes.
So a mom will nurse them 52 times a day if it takes that.
Yes, very true. And that's actually, nursing 52 times a day, that's not very manageable. So those would be cues, too, that maybe we need to see a GI doctor. When the infants are resisting feeding, a lot of times there's something going on because, healthy infants, they eat when they're hungry, they stop when they're full. If infants are not eating, there's a reason, and we need to figure out why, because that's going to lead to failure to thrive if we don't address that. Sometimes if with that resistance to feeding, if we're having a lot of arching and discomfort present during and after feeding, those are definitely good signs to kind of think about if, if they are on reflux medications or not, do we need to go see a GI doctor about that. When infants are not growing because they're not eating enough or because they are getting adequate intake, either of those situations. If they're not eating enough, something's wrong to make them not want to eat. If they are eating what should be enough and not growing, something is wrong to make them not grow. Because that just doesn't work. We actually recently have had a patient in the hospital that for weeks we've been trying to figure out why is this child not growing, and they did some testing and figured out that she's not absorbing the fat in her formula, and so it is then understandable. Okay, well that's why she's not growing. Let's get her the enzyme she needs. Let's change her to a formula she'll digest easier, and hopefully get her to grow now. It's also a good idea to refer to a gastroenterologist if it's getting to be multiple allergies that we're trying to avoid in a breastfeeding mother especially. Multiple foods trying to avoid those can have nutritional risks. And at least the GI practice that is associated with Arnold Palmer Hospital, and I know some of the other GI practices in town, they do have dietitians that are able to help with that allergy and figuring out what to eat, because it can get really difficult when I say, oh, okay, we can't have any milk, we can't have any soy. Oh, that didn't work, let's add eggs on top of that. Oh, that didn't work, let's add wheat on top of that. And then you start potentially cutting into the mother's nutrition, and she will deferentially put her nutrition into her breast milk and become malnourished herself until she gets to the point where she starts to not have enough for breast milk anymore either. So I just wanted to bring up lactose intolerance versus allergy. I see a ton of confusion between the two. Lactose intolerance is not common in infants at all, because lactose is the primary carbohydrate source in breast milk, as I can tell you already know. And so most infants are not reacting to breast milk. Now, there are reduced lactose and lactose-free formulas on the market that are marketed for colic, and I have to say, as a dietitian, I have never once recommended those formulas. Never once. Now, we have many patients who come in on those, and sure, we'll keep them on them, but those aren't formulas that I recommend, because lactose intolerance is not common, and it's something else.
When I'm doing education with parents and they bring up that's what they think's the problem, I say, did your child have its infant screening? Did it come back galactosemia? Because if it didn't come back galactosemia, your child does not have lactose intolerance.
Exactly.
Because they really, there's such, and that's the reason all these formulas, what they say on the can and things, there's such a misconception. We have adults who are lactose intolerant because we are the only species that drinks another species' milk and the only one that drinks it past infancy. So we become intolerant to it because we're not supposed to be drinking in the first place.
Yeah, there is a decline of the enzyme to break down lactose that can happen. It doesn't happen in everyone. So not everybody is lactose intolerant, even adults.
Yes.
And so it's very, very common to see that misconception. And you're right, galactosemia is the only reason that an infant would need a lactose-free formula. And so usually, if there's a problem, it's probably more of that proctitis, so proctitis that's going on. And so really, milk sensitivity, milk allergy, it's really kind of all the same thing. A hypersensitivity is the same as an allergy. It's that non-IgE mediated reaction. So it's not going to have the super scary side effects of, they're going to stop breathing and could die on us. So the treatment for that is to avoid milk proteins. And if just milk protein avoidance doesn't work, then you add on soy to that process. So because this allergy is a non-IgE mediated process, they actually don't recommend any allergy testing, because skin prick testing, blood testing, all of that is looking for an IgE mediated allergy reaction. So basically, to confirm a diagnosis for this, what you're going to do is you're going to remove the cow's milk from the mother's diet, and then you are going to give them 3 to 14 days to see if symptoms improve. If symptoms improve, and then the mother decides, hey, let me just test this out for sure, and goes back on the cow's milk, and you see them return, and then you have a guarantee. Well, that's the problem, and if she would like to continue breastfeeding, then avoiding cow's milk is going to be the best way to handle that. Okay, so we kind of started already talking about the treatment. So proteins from the foods that we eat are present in breast milk. So the milk protein, you can find that in breast milk. You can find wheat protein and egg protein in breast milk. So from everything that I was able to find from a research standpoint, because my biggest question was, well, how long does it take to get out of the breast milk? And so everything I was finding from some research, and then also from our gastroenterology group, is that usually 3 to 14 days is an adequate amount of time. So when a mother starts eliminating milk, you might see symptoms start to improve within 3 days, and give it a full 2 weeks if it's not immediately within those first 3 days. And I guess, already did mention that if they want to continue breastfeeding once the diagnosis is confirmed, then they should continue on that milk elimination diet. If the symptoms improve a little bit, but not all the way, then you might be on the right track, but just not avoiding enough protein. So then you would consider adding soy avoidance next and see if that helps, and then potentially egg if the symptoms are continuing to persist. Yes, ma'am.
Can I just remind, I don't even know this answer, so I just want to confirm. Every once in a while, someone will say, you know, I couldn't breastfeed because my baby gave birth to my breast. It's not the mother's protein in place of the other diet.
From what I read, typically it's the other from the diet. Some of the proteins in breast milk are a little bit similar to a cow's milk protein, a little bit similar. So in an extreme allergy case where you can't get it to resolve, it could be a potential, but I think that would be very, very rare. That would be somebody that, you know, they've had to take them off all of the major food, the mom off all the major food allergens, are still not resolving, you know, then you might kind of entertain that, but I would say that's not going to be a common thing for the baby to be actually allergic to the mother's milk. I think it is the food protein that's in the mother's milk. Yes, ma'am.
Is there any comparison to when mom says I was allergic to peanuts, I was allergic to any type of foods? Should I avoid that with breastfeeding?
So there is actually there's been a lot of research on introduction and avoiding food allergens for patients who have a family history of food allergy and don't have a family history of food allergy. The past thinking was always that keep all those allergens out of the diet as absolutely long as possible. But more now, this pendulum is actually swinging the other way, where more and more research is showing that early exposure and that frequent exposure, even in patients who have had peanut allergy in their family, that early exposure actually helps kind of desensitize them from the allergy, and then they're less likely to develop allergy reactions from that. So that's kind of the area that the research is going right now. And so it's been a very intriguing area of research, is the idea of, even in some of these milk intolerant infants or milk allergic infants, I should say, that what if we start giving them a cooked milk protein? Is that going to help desensitize them sooner to the allergen? I don't think they've fully kind of elucidated that at this point in time, but it's definitely something that there's a lot of research going on about. So our next, we have, we're going to kind of move on and start talking about labels and foods that have our allergens in them. So whoever raises their hand and gets the question right, we have which food contains milk or dairy. And I have to say, I use these interchangeably. So we have I have somebody over there who's eagerly telling me, G.
Yeah,
Yes.
all of the above.
Yes. And I did this because I get so many children with, they're milk allergic, but they're eating Ritz and goldfish and, just whatever bread they find in the grocery store, which, often those kids are also allergic to soy, and it either has milk or soy in it, if not both, as most breads do. So yes, all of the above. So then for milk ingredients, there are quite a lot of different ways that we see these on the label. Milk is butter, butterfat, butter oil, butter acid, butter esters, buttermilk, casein, casein hydrolysate, caseinates, cheese, cottage cheese, cream, curds, custard, diacetyl. Diacetyl. Who would think that's milk? Ghee, half and half, lactalbumin, which for me, I'm like, oh, of course, it's a sciencey term, so I get it. Lactoferrin, lactose, lactulose, milk, non-fat milk, and so on and so forth. There's evaporated milk and a very long list of different forms of milk. Milk protein hydrolysate, pudding, rennet, casein, sour cream, sour milk solids, tagatose, whey protein, yogurt. A lot of different ways to describe milk on the label. Yes, ma'am.
Non-dairy coffee creamer has whey and casein proteins in it. It's in the label. It's in the label. It's in the ingredients label.
It is in an ingredients
So,
label.
you know, we really, really have to do our education when we're talking to these moms about eliminating dairy.
Yes.
As well as soy, because that's another thing that's in everything. Soy
Yes,
flour,
it is.
soy oil. It's amazing.
Yes, it is. So, I switched the slide because in foods commonly contained in milk, non-dairy products is one of those things. And so our non-dairy whipped cream that they've occasionally tried to send to my milk allergy patients, I have to kindly remind them that they do actually have milk proteins in them, and my milk allergy patients cannot have non-dairy whipped cream. Artificial butter flavor, baked goods. So this is our breads, our anything that comes from a bakery you need to be checking because it's going, a lot of them, chocolate, yes, chocolate. Now, I didn't get them in my slides, but there are some great alternative brands out there. There is one for chocolate. There is one that I love called Enjoy Life. They make quite a lot of treat type products, so cookies and bars and stuff like that, and they make chocolate candy bars that are pretty good.
Mm-hmm. Yeah. They have
Yes, I know. My sister-in-law was avoiding
Ben and
milk with
Jerry's
her.
now has a vegan, dairy-free.
Mm-hmm.
Oh yeah.
It's very good.
Ice creams, there is so much on the market nowadays to help with the food allergy avoidance. It's really, really quite amazing. I know I passed around a handout with some of the different alternatives that I have found. I have to say I didn't go through and update it super thoroughly because I made it a couple years ago, and I was looking and I updated it some, but I was like, oh, there's a lot that I could add to this because there's a lot of products on here. There's a lot of different non-dairy yogurts. There's all sorts of non-dairy ice creams, of course, all our different plant-based milks. Chocolate, all sorts of things nowadays is really, really helpful. Caramel candies are another thing. Crackers, we talked about our goldfish and our Ritz crackers, but there's quite a lot of other crackers too that have milk in them. Lactic acid starter, culture and other bacterial cultures. So a lot of even soy yogurts actually still have dairy in them, so you do have to be a little bit particular when you're getting into yogurt alternatives to be really strict on looking on 100% dairy-free because there's a lot of the soy yogurts use dairy cultures in them, but there are some like coconut yogurts. So Delicious makes a coconut yogurt that's actually pretty good. They also make an almond milk-based yogurt that is 100% dairy-free, and there are some other brands. Almond Dream also makes some dairy-free yogurt alternatives as well. Luncheon meat, so we have to be careful on the meats that we're picking from the deli counter, hot dogs, sausages.
Bologna, all the, whey and casein.
Yes, margarine, Nissen, nougat. There's milk is in a lot of foods, and so when you're avoiding milk, you have to read the label of everything you're putting in your mouth. When you're avoiding any food, really, any allergen, you have to read the label every food every time. There are spices that contain milk. We are going to get to the labeling laws, so there is some help with that because of the way the labeling laws are written, but only if it's one of the top 8. So some of my concerns as a dietitian when you're eliminating milk from somebody's diet is some of the nutrients that milk provides that we don't necessarily get as easily from other sources. So protein, well, protein we have a lot of alternatives for. So if you eat meat, especially if you eat some good protein vegetable sources, then you're probably okay on that. But I get concerned about calcium. Vitamin D. Vitamin D is actually not common in the food supply at all, so most people do get their vitamin D from the milk they drink or the dairy products that they consume. Vitamin A, which again, that one's one that we can get pretty easily from our fruits and vegetables. Riboflavin, which is vitamin B2, phosphorus, potassium. Almost everybody that I ever analyzed their diet is not getting enough potassium. And pantothenic acid, which is vitamin B5. So they do recommend that breastfeeding mothers who are avoiding dairy should get a calcium supplement of 1,000 milligrams a day, which is the daily recommended intake, especially if they're not consuming anything that has calcium in it as an alternative. So some things that can be substituted and help get our calcium, leafy greens, although it's very, very difficult to get your full recommendation from leafy greens, not absorbed quite as well. There's calcium fortified juices, calcium fortified cereals, and then the fortified plant milk, so our soy milk, almond milk, that sort of thing. But you definitely want to make sure that you're going for one that has the fortification of calcium in it. So meats, poultry, whole grains are places that you're going to get your phosphorus, protein, and riboflavin. You can get B12 and protein from eggs. And then for vitamin D, if we're not taking a supplement with vitamin D, we definitely want to make sure we're getting that good exposure of sunlight, which is typically recommended to be about 15 minutes with no sunscreen on the arms and legs, so like a large volume of skin exposure to synthesize the vitamin D. Because of course we are able to make vitamin D, but the problem is we often use sunscreen, which blocks that production. So if we're putting sunscreen on before we go outside, like I always do, you're not making very much vitamin D that way. Okay, so our next one, and I have a feeling this is going to be easy too. Which food contains soy? Yes, all of them contain soy. So I guess which on there is most surprising? I put that on there because the Italian ice that we carry in our hospital has soy protein in it.
Oh.
Yes. Yes, ma'am.
Mm-hmm.
It depends on who you speak to. So the typical recommendation is that highly refined soy oil is non-allergenic because all of the protein from the oil has been removed. The difficulty is, in the general food supply, do you know that every single soy oil that's in the food is highly refined or not? So could there be a potential? In terms of the practice that I follow, it's based on the GI physicians that I work under who have told me that they do want our soy allergy patients to be avoiding soy oil as well as soy lecithin because of that risk, and they just don't want to take that risk. Of course, it makes it very, very difficult, and the diet then becomes very, very limiting once you add that soy oil onto the list. Yeah, yes. So now, whether a mother who consumed something that had soy, highly refined soy oil in it, I have to say I would highly doubt there would be enough protein to pass into our breast milk. But the practice that I've had, and it's more been with the children with the food allergies, is we're very strict on it, and we do avoid soy oil. So our soy ingredients, we have edamame, miso, natto, soy albumin, soy cheese, soy fiber, soy grits, soy ice cream, soya. I know one patient that I had a food allergy, and the only thing she ever called it was soya. And soybean curd, soybean granules, soy protein, shoyu, soy sauce, tamari, tempeh, textured vegetable protein is usually soy, tofu, of course, soy oil, and soy lecithin. Now, like we just discussed, I put the oil and lecithin on there because in my practice, what we do is we avoid those. I'm not necessarily convinced that everybody across the board has to, and really the recommendation is to take that on a case-by-case basis with the physician driving what the practice is on that. Most of the patients that I see have severe feeding difficulties, partially because of their food allergies, so we're especially strict on how we manage those. So, foods that commonly contain soy. I have to say, one of the lists that I found was from Food Allergy Research and Education. Their list was quite lacking, meaning it didn't have half of these foods on there, and I added a lot of them. So they had things like the Asian food and the vegetable broth and vegetable gum and vegetable starch, but they didn't have all the baked goods and breads and cereals and hamburgers and butter substitutes and shortening and chocolate and candy and canned meats and fish, canned soup, canned tuna, crackers, gravies, processed meat, ice cream. Soy gives me a headache, liquid, and powdered milk replacements. So Pediasure has soy in it, in at least one form. Doesn't matter the form of Pediasure, it has soy in it. Ensure, of course, the adult products, they all have soy in them as well. I would have to double check on Carnation Breakfast Essentials. I know for sure it has milk proteins and it has lactose, which the Ensures and Pediasures do not have. So seasoning sauces, seasoning salt, snack bars, bouillon cubes, TV dinners, tamari. Soy is in everything, really. We use a lot of soy flour, a lot of soy protein. It's inexpensive.
Why it's in there.
It's an inexpensive oil because of the way the commodities work, and so it is in a lot of our foods. So, some nutrition concerns when you start eliminating soy. Now, soy itself provides protein, calcium, iron, folate, magnesium, riboflavin, phosphorus, thiamine, vitamin B6, zinc. And so there's going to be some foods that really where you get in trouble with the soy elimination is the fact that it's in so many breads and it's in so many other foods that provide you other nutrition that we do need. We do need some of the nutrition that we get from wheat, and we do need those vitamins and minerals. So if you looked at that impact that soy can have, it's going to be even more extensive than that. So things that you can substitute for soy, of course you can do meats, poultry, fish for protein, phosphorus, and riboflavin. Fortified and enriched grains for thiamine, B6, iron, folate, magnesium, and phosphorus. So then reading labels for food allergies. So it seems like you have a pretty good idea of where to go with that. In 2004, the Food Allergy Labeling Consumer Protection Act, when it was passed, it actually went into effect in 2006. And so basically what this did was it said that if a food had milk, egg, wheat, soy, fish, shellfish, peanuts, or tree nuts, those foods must be identified in plain words on the label. So if a product has whey in it, it has to say milk. It can't just say whey. So it can be listed a couple of different ways. It can say it in the tiny list of ingredients where you're reading that itty-bitty writing. And it might say whey with milk in parentheses behind it. It might, at the end of the big long list of ingredients, say contains milk and soy and so on and so forth. So it just has to be in plain words somewhere on that label. Even if it's in spices or natural flavoring, it still has to say that. So sometimes you might read a label and through that ingredient list, you're like, I didn't see any soy, but at the end it says contains soy. The most common place I find that is in tuna because they use vegetable broth often in tuna, and that vegetable broth has the soy in it. And so that's where I'm getting my soy from. So sometimes that's the case, is that it's in kind of an ingredient that's a little bit more hidden and not as obvious. Now, sometimes you will see products that also say manufactured on equipment shared with X, Y, and Z, or may contain milk, or made at a facility that also processes milk or soy or something else. Those are optional. The manufacturers are not required to put those on. So if they do, you probably want to add those to the avoidance list because they're straight out stating, they don't even have to do this, but they're stating, hey, we're using shared equipment, which means they may not be cleaning it thoroughly, so you might have a risk of cross-contamination. And so they have found that if the manufacturers list these, there actually sometimes is enough of the offending protein that you're trying to avoid in the food to cause a reaction. So it's definitely something very important to pay attention to. And that then limits your options even further because almost everything has that. Now, there are certain brands that they do work purposefully to be a more allergy-friendly brand and more conscious about that. And so there's certain brands that I've actually contacted and said, hey, you know, I wanted to use a product for this patient that has all these restrictions, but you say it's been made in the same facility as all these sorts of things. And sometimes I find that, oh, well, you know, this is how we clean our equipment in between, and this is what we do to make sure that the gluten-free wheat doesn't contact, or the gluten-free grains and the wheat grains have no contact with each other. Enough for me to be like, okay, well, I think I'm probably going to be comfortable with this particular patient than having that food. Because sometimes you get down to the option is they can make their food, and that's about it. Because there's so much of that. Now, there's certain companies that keep their factories free of everything. That's part of the reason I mentioned the Enjoy Life, that I appreciate that company, is they don't use any of the top 8 major food allergens in their food at all. So their factories are completely free of those allergens, so you know the risk of cross-contamination is not there. So as we were mentioning, foods that are not top 8 major food allergens can be hidden in ingredients like spices and natural flavoring. So I mentioned earlier that I've done some corn and sesame allergies. Those are ones that are going to be, could potentially be hidden in those statements. And they also could be listed on the label by a name that I wouldn't realize initially was sesame unless I had done my research so that I knew that. So in terms of reading labels for allergens, the practicalities besides the law is that you want to read the label of the food every single time you eat it. Manufacturers can change ingredients at any time. They can add on that statement about made in a factory or made on shared equipment at any time. And you cannot tell if a food is safe by looking at it. So when you're dealing with food allergies, it's if I can't figure, if I don't have that ingredients, if I don't know who prepared it to tell me who the ingredients are in it, then the safest thing to do is just avoid it. And so then The other thing is you want to read every ingredient on the list to ensure that the allergen is not present. This is a very tedious part of my job as I get to make all these allergy menus. So reading all of these labels over and over and over again, I certainly have some of them memorized. Because the law does not require that the allergen be bolded. It doesn't require that it's italicized or stand out in any way. So especially if you have that label that doesn't have that nice bold contain statement at the end, it's hidden amongst all of those ingredients. So you have to go through one by one, make sure it's not hidden up there and amongst those labels, amongst all those ingredients. So buying packaged foods without a label, that is just like eating something that you don't know what the ingredients are. So that's not a good idea. Bulk bins are also not a good idea. They're to high risk of cross-contamination, so you don't know who, used the scoop for the chocolate in with the cashews, and then you go behind and you get some milk from the chocolate. So those are just things that you don't want to do. There's also non-food items that have allergens in them, and they are not covered by the Act either. So things like vitamins, creams, lotions, pet food, modeling clay, finger paint, those are probably a little bit more concerned when we're looking at like those allergy reactions versus that breastfeeding mother, but just kind of in the interest of food allergy label reading, they're things that I'm passionate about. So for things that labeling laws do not apply for, knowing those alternative names is really helpful. There's a lot of great resources out there, so you don't necessarily have to memorize them all. I didn't get multiple copies printed, but the Kids with Food Allergy Foundation, which is one of my favorite places to go for information, and it's where I've learned a lot about food allergies. They have like little cards that you can carry around that have the different ingredient names of soy and milk and so on, so that you don't have to necessarily have them memorized. It's just something small that you can stick in your pocket or purse. Yes, ma'am. Yeah, you can print them from the website. It's a very nicely done website. Even if you are talking kidswithfoodallergies.com, and yes, it is on the handout. It's one of my favorite websites to refer families to. Even if you have an adult with food allergies, there are a ton of recipes because there's a lot of families on there that have children with multiple food allergies. So they've had to do a lot of thinking outside the box cooking, and so they have lots of recipes and so on. Yes?
Kids with food allergies also have some nice forms in there for parents to use, like when the babysitter comes over, so that you can put down what the child is allergic to, what to avoid, and what they're supposed to do from a medical standpoint if there's been an exposure. And there's also forms in there for daycare and schools that the parent can fill out already that kind of highlighting some of the concepts that they may not think about, and then they can print off that form, fill it out, and take it with them to the daycare or school too.
Yes, ma'am.
Are you going to address eating out too? I have a funny story of a mom that went to the Olive Garden website, looked up the allergen. Oh, good, the breadsticks are dairy-free, according to their website. Oh, good, the salad's dairy-free, according to their website. Came in twins, explosive, smelly, green, bloody stools. And she had been avoiding dairy. And she said, but look, I followed this diagram. I said, tell me, were those breadsticks nice and shiny and tasty? And she said, yeah, they were really good. I said, yeah. I said, how about that salad? Did you just get vinegar and oil for your salad? No, I got the salad dressing from Olive Garden. And she had specifically told the server, I am dairy free. I have to be dairy free. And the server proceeded several times to ask her if she'd like cheese on her stuff after she told her she was dairy free. You know, I try to tell my parents to ask to speak to the chef and tell them you will have an anaphylactic reaction if there is dairy in this.
Yes. That's actually a really important point. It's not something that I had included in my presentation, but I can definitely talk about that. There's another question as well.
Also, the ingredients at different places.
Yes.
I have a sister-in-law that's very allergic to a lot of things, and she went to Bravo, you know, and they changed the cheese.
Yes.
But they changed the cheese, and she had reactions in the hospital.
Yes, so in talking about restaurants and eating out, it can be extremely challenging, even with one allergy that you're dealing with, because it is correct, restaurants change ingredients, they change recipes. I would have to say that I know food allergies well. I've been studying it for the last 4 or 5 years, and I've been learning as I've had patients who have had allergies, and I've had to learn with. And that's part of the reason I know as much as I do about it. I know most of my coworkers are in over their head and ask me for assistance with allergies because they're like, you know the labels, we don't. And it is extremely difficult because you go to a server and they don't understand when you say milk allergy that you mean every tiny little itty bitty milk ingredient. You mean that the butter spray that they sprayed on their equipment in the back to keep everything from sticking, that's going to be a problem too. So it is a good idea. I don't remember if it's Kids with Food Allergies or the other organization that has a lot of really great information on their website is FAIR, Food Allergy Research and Education. That is also on the handout that was provided, and their website, I believe, is foodallergy.org. One of them, if not both of them, has some really great information, like cards to go ahead and give to the chef and say, I have these allergies, you know, these are the sorts of ingredients. The fortunate thing is so many more people have allergy and intolerance issues or just avoid things out of preference that there is a little bit more awareness too. So sometimes even finding those restaurants that you know are a little bit more aware and cognizant of it. I'm an incredibly huge Disney fan, as a lot of my coworkers know, and you know Disney actually does a really excellent job in their restaurants about dealing with food allergies. I've had several of my patients came back and say, oh yeah, the chef came out to talk to us, they made sure nothing was in the food, and so some of it is even just finding that restaurant that you can trust, and sometimes those chain restaurants are not the ones you're going to be able to trust quite as well because their turnover is higher than maybe a small mom and pop place who knows a little bit better. You know, it's hard for us to know, for me to know in the hospital system, and I manage all the allergy menus for the Feeding Difficulty Center and actually really most of them for my hospital, and we're not always notified of when a product changes. And so when they get a different brand, when they change ingredients, and so, you know, recently I found out that, oh, they've been telling me that, oh, no, nothing's changed, and then all of a sudden, oh, this is showing up as non-compliant in the system, and here's my label. I said, well, that doesn't match my label, so apparently the product was changed. And nobody had mentioned it. So it even happens in the hospital system. You know, it's a difficult thing managing allergies. It really is. And I have to say, kudos for any mother who decides that they're going to restrict their diet and still breastfeed their baby, because it's not an easy thing.
It's alternative though. The formula is so good.
Yes, they're expensive and they are not as tasty.
Right.
Yes, ma'am.
Now, I want to thank you. So from time to time, I'll get called to talk mother about the diet because the baby's gas, or the baby's belly seems difficult, but it's not like a neck.
Right.
And, you know, in the past, it's been my perception that they were wanting me to eat out with gas.
Yeah.
Mm-hmm.
I always said that I'm dairy. Now, in the past, I said that for some babies, it's enough to just eliminate roast esophagus, milk, like,
Mm-hmm.
and then I would follow that. Some that you need to are some that are a lot more sensitive, that are a lot more sensitive to reading labels and stuff. Was I accurate in saying that for some babies, just for some babies, you know, just probably not the sick, probably not the sick, but it just looks
Right.
but it's just gross, and I don't drink milk, gross, and I don't
Pediatrician,
That's
same
that's
thing. I say it's like being a little pregnant.
Yeah,
You either are or you're not. You're either a little sensitive to what you're sensitive. You're sensitive.
yeah. I think that question about, you know, if you can be a little bit sensitive but not, kind of goes back to the ones that might have blood in their stool but are happy and growing well. So I think, you know, on those babies, we don't have to go quite as far. So maybe they would do fine without avoiding the Ritz crackers because they have butter in them. And, you know, let's be real, butter is mostly not protein. It's mostly fat, and we react to protein, not fat. So there might be some cases where people can get by on less because their babies are not as sick or it's not as strong of a reaction. It's not necessarily something that I saw in any of the articles I read in preparation, but that doesn't mean it could never happen. I mean, we definitely see, I've seen allergies, and like I said, we take a really strict approach in my feeding center to allergies, but I've seen patients who say they have an egg allergy, and it's really that they eat everything that has egg cooked in it. They've never actually had like scrambled eggs or a hard-boiled egg or something like that. And so, you know, it did feel a little silly avoiding all of these products that we knew that she didn't react to for 4 weeks when it was really just that whole egg. Exactly. And yes, there is, it does become a trend. And I think allergy and elimination is a trendy thing right now. And I think that's just something to be aware of. Now, the trends help a little bit the people who have real allergies, because look at all the gluten-free products we have now that we didn't have 20 years ago. You know, it's a lot easier to avoid some of those things now than it was in the past. So the trends help on that way, but then they also do a disservice, because then when you go into that restaurant and you say I have an allergy and you mean that you have a severe allergy, they don't take you seriously because somebody else just told them they have an allergy and they tolerate milk just fine. You know, so like that's where it's a disservice that we've had some of that going on.
I was going to say, then there's also the psychological component. How many of you can honestly say you've worked with moms that are not obsessed with poop or their baby's gas?
I have asked them many times if they inspect their own stools as often as they inspect their babies. And I quote Jack Newman, wear sunglasses so you can't see the color of the stool.
Right. So these moms are obsessed with it. So when we're saying just avoid the obvious, but the poop is still green or slimy or blood in it, they're freaking out. Okay, then get rid of it all. Okay. I don't know what to tell you. But these moms are psychologically, they get hyper-focused.
Yeah, and then there's Google that always, you know, makes it even more.
Yeah. Yes, ma'am.
Here we are, every one of us has had, or not currently worked with somebody who.
How much of it's reported? How much of it is that we get? Our population's skewed. People don't come to us because their babies are breastfeeding. Very few. I get maybe 10 a year. Happy breastfeeding nurslings.
Yeah.
It just seems like it would be more than 1% of all of us.
Yeah. I mean, it does seem that way, but I also know that when I think, you know, in my experience, all the children I see are sick and have chronic diseases. I cover the pediatric special care. I think every kid has a trach and a G-tube. So some of it is because we do specialize in these sick populations and these populations that are having problems. You know, we are going to get more of we're going to see more, and it's going to seem like there's more than the real incidences, which is why I think it's nice to be like, oh, it's really not as bad as it looks when I see my patients.
Mothers who go on a food jag during their pregnancy, you know, the mother who she doesn't like milk, she never drank it, probably because her body wasn't happy with it, so she never drank it. But someone convinced her that if she didn't drink cow's milk when she was pregnant, she was going to have, this baby that came out, with
Right.
4 legs and udders, instead of a baby. So, what she's eating when she's pregnant, I've found that mothers that went on a food jag and really ate a lot of something that was a protein, not collard greens, but cow's milk. I had one that ate corn chips, Frito corn chips every day. This baby, from the time it was born, screamed until I said to her, was there anything you ate during your pregnancy that you ate an overabundance of? Not a normal amount. Oh, yes, I ate Frito corn chips every day. How much did you eat? Oh, sometimes I ate a whole bag. And are you still eating those? Yes. She stopped eating them. And the baby was happy. My grandchild had, my daughter ate about 5 dozen eggs per week. She was doing the Bradley method. This child grew up in La Leche League. She decided when she was real little what kind of birth she wanted to have. She decided the whole thing. Protein. She was very busy when she was pregnant, and she needed a fast food. Scrambled eggs become her fast food. She wanted to eat 120 grams of protein per day. That's the Bradley method. You're going to have a brighter baby, bigger head, harder to get out, but they usually are big babies. Bradley babies are big babies. It was almost 9 pounds, big babies. They have higher IQs. All that protein, all that DHA from those eggs. She ate the first scrambled eggs when he was a couple of days old, and he broke out with blisters all around his mouth when he breastfed. She couldn't have eggs until he was about 6 years old. At about 4, she started giving him things with a teeny bit of egg in it. He touched an egg shell one time and broke out. So he's highly allergic, but that was from her. She actually sensitized him to eggs.
Yes, and that's where that kind of goes back to that question that was asked earlier about the peanuts and everything, and that's where the research isn't entirely sure in terms of sensitization, like after birth versus before. Right now the recommendation is to, not have moms avoid during pregnancy potential allergens, but I'm sure that most of that research is looking at people who are doing things in moderation.
Exactly.
And you will find pretty much every dietitian you ever run into is a huge fan of that idea of moderation. Most people don't like it. They think it, seems a little silly that, yeah, I'm going to eat that piece of cheesecake that I have twice a year or less, because it's moderation, and so it's a concept that we talk about a lot, but a lot of people don't understand. And I think that might be the key difference in seeing the reactions after pregnancy versus what the research is currently showing. So we did talk about not eating foods with advisory statements because of the exposure cross-contamination. So then label reading, I think it seems like a lot of you have done this. So I just kind of have a few. So on this, I mean, most of us know ice cream comes from milk, but in terms of the ingredients, very first one, milk, cream, non-fat milk, and then at the very end here, it still has our nice little contains milk. So you will find labels like this one that are super easy to read because they're very, very obvious. On our peanut butter, it's not quite as clear because part of the labeling law actually is that soybean oil doesn't necessarily have to be labeled if it's highly refined because it's considered non-allergenic. So sometimes you will see something that has that little contains statement at the end and it doesn't say soy even though it said somewhere in there that there was soybean oil. Oh, didn't go that far. So like this one has soybean oil. This is the peanut butter that we carry in the hospital, so I don't allow my soy-free children to have it. This is our non-dairy creamer that we talked about that definitely has dairy in it. It has the sodium caseinate, the milk derivative. And then this too also would not be good for a soy-free diet because it has hydrogenated soybean in it. It's not even the good kind, it's the hydrogenated kind. English muffins. Not necessarily the first thing that we would think of as containing both soy and milk, but it has ingredients. And one label I found, the soy that's right here that just says soy there, it's actually, it says soy protein, I believe it is, or soy flour, that's what it was on one version of the label that I found. Okay, so this is actually where we need our handout to pass out. So this is, the challenge is I have 10 labels for you all to look at, and underneath each label it says milk, soy, both, or neither. So what you're going to do, I'm actually very impressed with how well those came out. I know they're tiny, and that's what I do all the time is read tiny little labels like that.
Another thing moms are often told is, well, you know, if milk isn't in the first 5 ingredients, you're fine. If the last ingredient, there's very little of it in there. That's why they put it as the last ingredient. So what do you say to that?
I would say that if we still have a baby that's still fussy, that's still having difficulty feeding, that we still have to see them for lactation assistance, then they need to be avoiding every single milk ingredient on that list because even the trace amounts there can be exposure for that. And so that's why, that's why we have some babies that just avoiding milk isn't enough, and you have to go further. You have to avoid soy, you have to avoid wheat, you have to avoid egg, and it can get really difficult. So the prize part of this is who has completed it first and has it correct.
You're going to get an ice cream cone. No.
We have Starbucks gift cards. Of course. Mm-hmm. Okay. I would say possibly you could develop a sensitivity to something. It's a little bit dose dependent actually. So if you look at peanuts, some people who react to peanuts didn't react to peanuts early in their life, and like it was kind of as they got older that they developed a reaction. So it might be possible especially if there's history of allergy, atopy, those sorts of things, eczema, that you might want to be cautious on how much they're doing of the alternatives. Generally, really about 3 servings a day is adequate. 3 to 4 servings, depending on the amount of calcium. So a lot of the alternatives are fortified with about 30% calcium of the daily amount of calcium per serving. So really, if you're doing 3 of those a day, you should be getting adequate calcium.
I think that's quite the fact that our population has a lot of things to eat every day.
Yes.
I also heard doctors suggesting the variety for the baby who is growing, the mother, to make sure she's not eating the same thing all with black flour.
Every diet should have variety because if you look at all our food, there is not, there is not, you can't get your nutritional needs met from one food. So we need different fruits, we need different vegetables. They don't all have the same amount of nutrients in them, and so variety is extremely, extremely important, and children should be getting a variety on a daily basis and not living off peanut butter and jelly.
I don't share the story about and when he was sad or upset, he didn't want to eat his dinner. Well, and then he was blowing his nose all night.
Well, I think they got that from the basics, the protein, fat, and carbohydrates. And I don't think they were thinking about all the vitamins, minerals, and everything.
Okay, I'm checking out the order. So we'll go through all of the ones and we'll see. The last one was really hard. I apologize for that. But you can feel my pain because those are the sorts of labels I'm looking at all the time. Not at 7 and 8 o'clock at night.
Yeah. We don't have to worry about other people killing ourselves. We're doing it our mind ourselves.
Oh. Yeah.
While we're doing this, can we acknowledge any questions that have come up?
Hold on, let me see if I can. Yeah, there are. Okay, I only have one, and someone's asking how their clients can be seen by the speaker. So is that in the handout? Or?
It's not in the handout. I actually don't see outpatients except in the setting of the Feeding Difficulty Center. If you need your client, if you want your clients to see a dietitian, there's a couple options. There is, if they're already going to a GI center that has a dietitian, referring them to that dietitian, because GI dietitians actually do work very closely with allergies. Or there is a website called eatright.org, and there's an option to find a dietitian. Yes, ma'am.
Does it go specifically for pediatric dietitians? Is there information for that?
So if the baby you are seeing is going to a pediatric GI specialist, they will have pediatric specific dietitians. For example, the Arnold Palmer Hospital associated GI practice actually has 3 dietitians on staff, and some of them do work closely with like our eosinophilic esophagitis disorders, so they do a lot with allergies as well. And there's also pediatric GI or pediatric dietitians that work with the endocrinology group and with the renal group. And I do know at our Peds GI Center, at the very least, you can make an appointment just to see the dietitian only. So that is an option. Or if their feeding difficulty is that severe and they're old enough, I do sometimes see patients at the feeding difficulty center.
Can I ask another? Are you familiar with the ImmunoCap blood
Yes,
test?
I am.
And
Very familiar.
and what is your feelings on it? Or
well, the ImmunoCap blood test is not going to pick up a lot of the GI allergy issues that we see in infancy.
no, I mean they don't even recommend it till they're over 3 months.
Right. I have personally in my practice seen it as extremely helpful. We actually have had patients come through our program. We first actually made it kind of standard that all of our patients get that blood work done before they come to the program, because we had a patient come in the first couple of days. He'd never had pancakes before, vomiting immediately after pancakes. As soon as we did the blood test, he was highly positive to egg. So we had to put him on an egg elimination diet, and so we have gotten a ton of really good information. The nice thing about the ImmunoCap in comparison to skin testing is the ImmunoCap is a little bit more, a little bit less likely to have a false positive. So in skin tests, there's a lot of things that react, even if you're not necessarily going to react to the ingestion of the food, and the false positives then in the blood tests are much lower. So really, usually the IgE in the blood is only high if you're likely to have a reaction. And we actually kind of have certain thresholds that we use in guiding us on, you know, like what is a number that we're going to say, oh, this is high enough that we need to avoid this food.
We've been very pleased with it in the pediatric office, and especially those parents that come to me and they say, I'm afraid to start solids, or I want to wait until my baby's a year old because we have a lot of family allergies. So I suggest to them before they start solids to have the ImmunoCap so that they can give them a little bit of guidance.
Oh, yeah.
Because we don't want to wait till a year to start solids.
No, we don't want to wait till a year to start solids. We don't need more clients in our feeding center. We have a nice long wait list. Okay, I think it seems like most everybody is done. So, for our first label, we had a lean cuisine beef pot roast. So what did that have?
So,
Okay, sounds like mostly we got that one right. I almost missed that one because I missed that whey hiding early this morning.
Bottom cultured whey.
So this one didn't wasn't quite as obvious because it didn't have the statement. I also
you got to go to the eye doctor. That's my referral for you. It was several different.
Yep. Yep. I don't believe caramel color typically is milk. Caramel color, I think, is the same that they use in like Coke and stuff like that to get it the right color. And so I don't believe that it typically is. And this label was actually a little bit more tricky because it didn't anywhere have that nice little contains statement. Because really, it should have said, sorry, I keep pressing the, not the, but it should have said somewhere that had milk rather than just what I had seen was way down here. There is the butter fat there as well. But and granted, I did pull this off of the website versus having the actual label. And so it didn't have that nice contains milk statement like it's supposed to have. So I would hope the package is a little bit more clear. So then we have corn flakes.
Miss, right?
What was that?
I said it makes it surprising how much we could miss. We're looking for certain things and then you overlooked it.
Yes. And that's why this is.
At the grocery store as our kids are sitting there screaming in our ear.
Yes. And that's part of the reason I gave you this task is because it's a very challenging thing. I do this on a somewhat consistent basis, and it's challenging for me, and I miss things as a dietitian in the program, and you know, I've been spending years working on learning how to do this properly. So in our cornflakes, what do we have? Soy. Okay, yes. And it's just traces of soy. It's not actually in the actual ingredients. That's that cross-contamination. Malt has so why you might think of malt is because malt has barley, so that's a gluten-containing thing. So our Swiss Miss hot chocolate. Cocoa actually is not a milk product. So even actually cocoa butter, even though it says butter and it sounds like it would be milk, it is a dairy-free, a milk-free product. So, but it does certainly have milk in there. Okay, and then we have our ramen noodles.
That's right there.
Yes, this one is nice. You can kind of skip a lot of that because it has that nice easy, it contains milk and soy, so you don't have to look any further because you can say, oh no, that's off the list. Yes, ma'am. It was hard to read.
Neither had to be soy.
If it says natural flavors and it's one of the top 8 major food allergens, it must say soy on the label. Even exactly. If it says, if there's a product where it says natural flavors and it does not then also say contains an allergen, it means it's one of the ones that does not contain one of the top 8 major food allergens. So now where it gets a little bit tricky is it could potentially have gluten in it. It wouldn't have wheat in it, but it could have gluten in it because not all of the gluten-containing grains are part of those top 8 major food allergens. It could be gluten without being wheat, just like malt. Yeah, malt is gluten without being wheat as well.
That's right.
Correct. Yes. One of my all-time favorite sketches was one of our late night, and I don't remember who it was, but one of the late night comedians did a poll just in a random park. Oh, are you gluten-free? Oh, what is gluten? And nobody who said they were gluten-free could tell him what gluten is. And it was being passed around amongst some of the people, dietitian friends. And we know that if you don't know what gluten is, you are not avoiding it. Just not. So our pinto beans.
I guess so. Yeah, I guess so.
You were right with neither.
Good, that's what I had.
Good. The beans.
Yeah. And yeah. It's not necessarily soy. It could be, but again, that's where the labeling law is really helpful, is because if it's milk, if it's egg, if it's wheat, if it's soy, if it's fish, shellfish, any nuts or peanuts, it has to say it's a peanut. It has to say it has wheat, even if it's in the seasoning, even if it's in the natural flavoring. I think there was a question. Nope. Okay, sorry. So we have our sun chips.
I felt
These are full of milk.
soy snuck in there and they just didn't tell us.
I read it twice because I was short. There's got to be
Sure
soy,
that there was soy in there,
but there
right?
wasn't.
They're lying.
Okay, what about our oatmeal raisin granola bar?
Both.
Yes. And this was another one that has that really nice statement, contains. Okay, we have our saltine crackers. I'm really proud of you all for that because I didn't catch that the first time around I read this label. I was like, oh, it just has soy, and then I saw the may contain statement, and so I said, well, I might give somebody credit for just saying soy as well, because that's what I thought as a dietitian. Okay, we have our oats. Neither. Yes, yes, that was your freebie. Okay, this is chicken noodle soup. Both. I looked at this label 5 times to find the milk in it, but I didn't find any. There is soy, really hard to see, and I apologize because the cans are really hard to get that that picture taken.
I didn't see it. I see it now.
Yeah, it was. Really, I tried to get a good picture where you could see all the ingredients, but you can't really see it.
Okay.
Okay, did anybody get all of them right? Who got 9 right? Oh, we have several that got 9 right. I think we'll have enough gift cards for everybody who got 9. Okay, so see me afterwards if you got 9. Okay, so moving on from the labels, really we were spent a lot of time talking about how difficult it really can be to go on a restriction. So there might be some cases, we talked about some cases, maybe, if they fudge a little bit and get a little traces, it's not going to affect the baby. But there might be some cases where they just can't do it, and it's just getting too difficult on them. They went back to work, and now they're trying to pump and avoid all of this, and they're just completely overwhelmed. So we do have formulas that we can use to help out with this. So they actually don't recommend using soy formulas at all if we're concerned about milk allergy in an infant, because like we talked about, there's a really high cross-reaction. So it's very likely that if you react to a milk protein, you're also going to react to a soy protein. So so the recommendation is to go straight to a hypoallergenic, extensively hydrolyzed protein formulas. So basically, it is milk protein that they use, but they've taken it and broken it down into very small peptides. So most babies who have a milk sensitivity are going to do very well on these formulas. So we have several different versions. We have the Similac Alimentum. We have Nutramigen. Then there's Progestamil. The biggest difference between Nutramigen and Progestamil is the type of fat. So if you also have concerns about poor weight gain or malabsorption on top of a milk allergy, then Progestamil might be the way to go because it's higher in the MCT oils that kind of bypass some of those absorption processes. Yes?
So all of these are non-kosher though, because they're hydrolyzed protein, and the hydrolyzation process imparts pig enzyme processing. And so all of these for my Muslim or my kosher Jewish families are not possible. So it has to go to soy. just as a
Mhm.
And depending on the age of the baby,
depending on the parent.
and the parent,
Yeah.
I find that Dr. Sears's goat's milk recipe, I like the baby to be, my personal preference is to be over 4 months old.
Yeah.
But
Goat milk formulas are not super recommended. There's actually a high cross-reactivity between species milk as well. So there's a high between goat's milk and between
you may be
cow's milk
running
as
into the
well.
same thing we're running into. We're running into some really, really particular parents who have their own ideas about, as they start reading labels, that they don't want this going in their child. And so sometimes we have to get real creative and being as, you know, and offering alternatives of just, but not
Right.
something that would hurt the baby.
Yes. And I have to say, I've had to get creative on certain things in my day. I know a different arsenal. Being a dietitian, I have a little bit more exposure to some of the products that are out there. So I might use slightly different options.
Yeah. I mean, definitely, you know, these are the go-tos. So the parent starts giving you resistance.
Yeah.
And then, of
Yeah.
course, sometimes if you can just get them to try it and then they have a happy baby.
Exactly. And then too, I have to say, I haven't done a lot of research about the processes of how they break down the proteins. So I don't know if the process is different, because besides extensively hydrolyzed, sometimes you will get the babies that still have reactions on extensively hydrolyzed proteins, and that they just can't tolerate those either. And then we have to go all the way to our hypoallergenic amino acid-based formulas. So I guess I don't know if there's a difference between amino acid processing. I mean, there's a huge difference in price. The more you break down the protein, the more expensive it gets. But there are 3 amino acid-based infant formulas on the market: the Elecare, Pure Amino, and Neocate. If we are changing a baby in the hospital, we're going to change them to Elecare here at Orlando Health, because that's what our contract is. And then if there are differences that we need to take into account, then we go ahead and do that. But that's what we tend to default is towards the
What I
Elecare.
run into the different formulas with are with those parents that are formula feeding in a pediatric office. The pediatrician's still going to have them talk to me because I have more time and more knowledge of the different than he does. And so that's why yeah.
Yeah. So that is my presentation. So these are some of the references I use. And then questions.
You see more, I see a lot of times, you know, doctor, I guess like transition or one of the special formulas, and there's still breastfeeding. You see less allergy problems with, like if they're exclusively breastfeeding, or do you see it's a combination versus it's floating away from they can still be feeding on like healthcare or something.
Yeah, and some of that is, I actually have run into some mothers that are extremely dedicated to their elimination, and they want to get their baby as much breast milk as possible, but maybe because they were in the hospital for a while trying to figure out what was going on, their supply has dwindled a little bit. I know that we have fortified in the hospital breast milk with Nutramigen, Alimentum, Elecare, pretty much all of it, you know, and we'll talk to the mother about avoiding the proteins that we're concerned about in their diet. There are occasions where, and I know we as dietitians, we hate to see it, but there have been occasions where the GIs will finally say to the mom, maybe you just need to stop breastfeeding because, you know, we have them on supplemental Elecare and they're fortifying with Elecare, but the baby's still having problems. And so sometimes we do get that. And I hate that it goes there, but sometimes it does. Then they do usually do okay on the Elecare, yes.
I don't know if you've had much opportunity for research. I work here as well. But my theories are, and I don't have any way to do the research as of yet, is either A, I'd love to see some research come out with the baby that got that one drop of formula that ended up with this dairy sensitivity,
Especially
and
those young
B,
babies.
antibiotics, and possibly the combination of antibiotics and the drop of formula and the maternal antibiotics that they get too. There's a huge research right there that needs to be done. Yeah. I know, I have a lot of time.
I know.
Harriet,
I know.
Would you see, and that would be
Oh,
interesting
yeah.
for you to put on your intake. You know, did your baby, did you have antibiotics? Did your baby get antibiotics? Even however old they are, did you?
Oh, yeah,
you know,
yeah. That would be an interesting question to look into.
Also, the safety kind of new to the picture. You know, I wonder if there's anything, it's kind of scary, I don't know, the way that they're describing it.
I do know that they don't try to give them to everybody, but at least in the hospital setting, we do have a lot. Yes, primary doctors certainly. I know in the hospital we try to be judicious and give it to the babies that really need the control of their reflux because they're not gaining weight and such. But yes, they are prescribed very judiciously.
Yeah, that's what I said. We really don't use these.
Yes, ma'am?
Are any of them considered kosher?
I can have a kosher question. On the can of the formula, there will be a little H or a K on the can. So go look through your formula cans. The kosher is labeled. It is labeled on the can. And so I can't see the can well enough to, but it is.
Okay, the okay.
Usually it's
Yeah.
It's a circle, go look at your formulas and you will instantly know which that are kosher. The hydrolyzed are not kosher. Okay, just as a general statement, all right?
no, so any formulas with a K has,
Well,
would be kosher bread.
For those of us with clients in the Central Florida area that, you know, moms would love to be able to see someone like you, I have heard, and again, it's just through a mom, that the criteria was baby had to be failure to thrive or not gaining weight in order to get a consult or be seen in the feeding clinic.
In the Feeding Difficulty Center, well, typically we actually take older children, so we start at usually about 18 months, where they need to know cause and effect because of kind of how our whole program works. And so we actually have taken many children who don't actually meet the qualification for failure to thrive. I plot out all their anthropometrics, so I know that very well. And actually, if a child is like on a G-tube feed and failure to thrive, that's actually a criteria that they can't come yet because we need to figure out why they're failing to thrive on G-tube feeds. So, but if they're a kid who is eating and just not eating enough and failing to thrive for that reason, that's definitely a criteria, but it doesn't have to be that their nutrition is and their calories are so inadequate that they're failing to thrive. Because we see a lot of children who just have extremely poor diet variety, so maybe they're growing fine, but they have all sorts of subclinical
I'm going to email you
deficiencies.
privately so we can figure out what we can do for some of these mommies that need someone.
Okay.
No.
That is correct.
Yeah. Now, these moms need to talk to someone like her that they aren't reading the labels correctly, or that go ahead and eat this, it's okay, you know. That's what I'm looking at, is that they're so restricted that they're creating anxiety over everything that they're eating. They probably need something. They also need our Mothers Matter, which is our postpartum and anxiety group.
I think it's like, you know, the pediatrician doesn't have enough time. He might know he may be a very supportive breastfeeding doctor, but he may not have the time it takes to do lactation support. The GI doctor doesn't have the time to go into the kind of detailed diet history that the nutritionist does. And I think that's kind of like, you know, so the working together or to be referred over to you is very, very beneficial. Or like the endocrinologist who's going to refer to the dietitian, you know, for the diabetic, you know. So that's where I see you would be hugely helpful, and because the general public is so confused about nutrition, and like the lactose intolerant thing, you know, everybody thinks. I mean, we've just got so many misconceptions out there. With a little bit of knowledge is a dangerous thing.
Yes.
Yeah.
Yeah, there's a lot of people who think they can do my job without the 6 years of education that I took to get here.
But more mothers need an avenue to get to someone like you. That's what would be so beneficial.
Yes, yes. And I think that it's been a difficult area for dietitians because our services are not well covered unless you have a specific diagnosis like diabetes, like kidney disease. And so it's been a challenging thing to be able to get dietitians in a place where we can see patients from an insurance standpoint. So I can see patients in the feeding center in the context of the feeding program because we get approval from the insurance companies because that's part of our program. But that's definitely been a challenge of dietitians kind of everywhere, is that so many of the insurances just follow the Medicaid and the Medicare rules, which are very stingy on what you can see a dietitian for and when they'll pay for it. And most of the major insurance companies follow them and kind of follow those guidance.
How many allergists refer to a dietitian? Are there?
Not enough.
Exactly.
I mean, in my personal opinion, there should be a dietitian in every single allergist's office.
Yes.
That's something I'm certainly convinced of after all the time I've spent cleaning up these kids' diets. Come into the program, they have no idea how to avoid the food. It's part of the reason they're not eating. And then I spend hours with them going over, oh yes, you can have this, oh no, you can't have that, let's read labels here, this is how you shop, this is where you go. That's where that handout that I created, and I have many more. I have multiple allergies. I have everything under the sun that I've made for that.
Utilizing people like yourself more, like utilizing lactation consultants, we could save a lot of healthcare dollars and the treatment that's being done if we did more education. And
yes, I'm a lot less expensive to see than a doctor.
We have a lot of things in common.
Yes. I did not.
Thank you.
I firmly believe in licensure for dietitians, so I think it's actually a very important process because I know it helps protect the public as well as our profession and the integrity of our profession.
And hopefully gives them more access to our care, because if we can work towards that reimbursement, that
exactly. And we're making small steps towards reimbursement. I was actually the first dietitian in our entire organization that had any outpatient services reimbursed for my charges. Like not charges put in under a physician, but in the feeding program, that was something that we pioneered. And so it's definitely been an interesting learning curve for me because we don't charge for our inpatient services. We are a cost center. So that's how we operate, and that's how most of us work. And that's why it's frustrating for people when they call the hospital and want to see a dietitian, because we don't see outpatients because we don't have a structure to charge and to do all of that and to get reimbursement for it.
Thank you. Thank
you. Okay, for those people that earn their prizes, I have them.
I'll take evaluation and I'll give you your cert.
Good job.
Oh, thank you. Oh, well, thank you very much. Wow.
Yes, ma'am.
I want to say thank you because you're awesome. You're awesome.
Thank you.
Have we officially finished the meeting?
We have